Recording in progress. Recording stopped.
Colleagues, good morning to everyone, the management of the PC. If you can just indicate whether we form a quorum, but I realize that colleagues, okay, I see that there are people who joined, who appear on a first name or surname without full names. If I may request that you indicate your name and surname so that I'm very clear and all of us know who is in the meeting. Please, colleagues. Just help me with that.
Thank you very much. A very good morning, Chairperson. I see that I only have Mutusi's iPhone. It's Honorable Mutusi Montwedi. Thank you very much.
Okay.
And greeting to everyone in the meeting.
Thank you. Thank you, Honorable Tusi. Please, others, please help me do that. Nhlanhla, if you can try and assist everyone else so that we start with our meeting.
Morning, Madam Chair. My hand is up. Vali speaking.
Who is speaking?
It's Vali speaking, Madam Chair. How are you?
I'm fine, Vali.
Excellent, excellent. Madam Chair, my name on your system is also just Vali's S24 Ultra or something. It is on my cell phone, so unfortunately, I'm not clever enough to change the name on my cell phone now. I just wanted to let you know if they can change it, it's fine. But please note that it is me. Thank you very much.
Thank you,
Madam Chair.
Honorable Okamp. The Nkandla will assist you as long as I know those who are not able to change their names. The administrative team will help you. Well, thank you very much. We will start in the meantime. I just also okay. I see that we also have the Director Food Safety and Quality Assurance from the department. Thank you very much. Let me go back once more and greet you, colleagues, and wish you well for the year ahead, because we have not seen each other. I hope that everyone else had a good rest and good holidays. As we start this year, we're looking forward to having a great year ahead. If we start very well, it will help us to continue in the same direction that would help us to do our work. So may I then request, you are welcome all colleagues, may I then request Albertina just to indicate the attendance of the members and whether we are duly coordinating as a committee.
Thank you very much, Chair. Good morning, Chairperson, members and colleagues. Chair, the committee do coordinate. We've got Uche, we've got Tatu Mwetama, we've got Tatu Tsebekulu, Mamundalane, Tatu Mtweti, Tatu Smith, Tatu Okamp, Mamu Lucas, and Tatu Mtetwa. So we do coordinate, Chair. And from the apology side, Chair, we've only got 2 apologies. One from the minister, and the second one from the DM Kappa. The minister is having a standing appointment on with international stakeholders in Pretoria today. And then UDM Kappa is in the preparation for Cabinet Lekotla. Thank you, Chair.
Okay. Thank you very much, Albertina. We do have a quorum, so we can start our meeting. May I just hear the voice of the colleagues on the apologies, because we only have 2 apologies from the department, which
Good
comes
morning,
from
Chairperson. Ethel Trollope is present in the meeting.
Oh, okay. Thank you very much, Honorable Trolley. Appreciation. Okay, thank you. There we have our agenda for the day. Allow me, colleagues, just to take a brief moment and indicate the purpose of the meeting today and how it's gonna go. Now, I want to just indicate to colleagues that in the last term, the minister mentioned an investigation that was being undertaken regarding the source of the organophosphates or agricultural pesticides that contaminated food products from spaza shops, resulting in several deaths in Gauteng and in the Free State provinces. The minister promised to report back to the committee on the outcome of the investigations. He only gave us a brief a report. Members would have noticed, therefore, that in the proposed draft committee program that was circulated to members, the minister was supposed to report back today on the investigations, including other matters such as the honest report biological product and the separation of the two departments that are still merged. However, as you have noted, I have received an apology from the minister and is unable to avail himself today due to prior commitments, as stated earlier, with international stakeholders. I then propose that the agenda for the minister be rescheduled to the next meeting, that is next week, the 4th of February. Regarding the issue of the contamination of food products from spaza shops by pesticides, members will recall that Honorable Mkutama suggested that the committee invites Dr. Klute van Vuren in the last meeting to hear out his views on the matter. An invitation was then sent to Dr. van Vuren seeking his expert input on the matter in the form of a presentation, including implications for the regulation of the sale and use of pesticides and other poisonous agricultural remedies in the country. Dr. Vuren phoned back the Secretariat and responded, trying to understand the role of the Portfolio Committee and what it seeks to achieve. He indicated that he is a physician and therefore he is responsible for treating patients who have been affected by organophosphates. He indicated further that he was cited in a newspaper article, which did not necessarily report his interview in the manner he has said it. Dr. van Vuren mentioned that what he observed as a physician and indicated in the interview as a concern was an increase in the number of patients that have been affected by the organophosphates and the significantly high quantities that they have been exposed to that have led to several deaths. He proposed that there be a need for an investigation into that. Now, as a physician and not an agricultural expert, he indicated that he does not have an expert opinion to assist the committee in its oversight responsibility regarding the regulation of the sale and the use of organophosphates and implications for food safety thereof. As members know, as the Portfolio Committee on Agriculture, we oversee the activities of the Ministry and the Department of Agriculture, which is responsible through legislation for the regulation of the sale and use of agricultural products, and also plays a crucial role on food safety. We therefore invited Professor Liz Costin from the University of Pretoria to make a presentation on the matter. Professor Costin is a professor of plant sciences, plant pathology section in the University of Pretoria's Faculty of Natural and Agricultural Sciences, a co-director in the National Research Foundation Center of Excellence in Food Security, and is also the chair of the International Society for Plant Pathology Task Force for Food Security. She's an expert on food safety and regulatory control. I do believe that the presentation and the discussion with Prof. Costin will greatly assist the committee in its engagement with the minister and the department when they come back. So we have Prof. today. Now, the second matter is that Honorable Trollip has requested that we include an item on the agenda that he would like to share with us regarding the visit that they made with the DG. I want to request that we allow Honorable Trolley, once we have dealt with the issues and the discussion of the presentation by Professor Costin, to allow Honorable Trolley to introduce the matter. And let's see if it's possible for us to discuss, or we will then request that a full presentation be made in the next meeting, where either the DG, when the minister is here, would also be present, or the leadership of the department itself. Now, Honorable Trolley also raised the issue on the AAPs, the Assistant Agricultural team that wrote letters to us last year, to the portfolio committee and also to individual members. And that matter has also been raised, I saw in the group, by Honorable Kutama. May I then, on that matter in particular, say that colleagues, you'll remember that we have had a discussion in the committee ourselves, and we requested the department to come and make a presentation and brief us on how far was this matter handled. And consequently, indeed, they came, and we raised it also in the RRR report. Now, in terms of the procedures, we did that, I think it was in November, at end of November, December, when we sent the report. The department has 3 months to respond to those issues that were raised in the report. I want to then request that we give the department an opportunity to respond. They have not yet responded. But if there is a matter that the 2 colleagues would want to raise around the issue of the AAPs, please do so. We will allow you to do so, Honorable Trolley and Kutama, at the end, so that we understand the reasons there of bringing it again today, and then we'll again assess as a team whether we would like to discuss it or take it into the next meeting. I only wanted to indicate to you colleagues that the department has not yet responded, but they still have time to respond. We gave them the report in December, so this is January. They still have February and until March for them to be able to respond. So I wanted to summarize the issues in that manner, and I will then allow members to comment on the issues, because the agenda states only the item that Professor Costin is going to discuss. I have brought these matters because they have been brought by yourselves, colleagues, on our platform. I will see by raise of hand if colleagues would like to comment on the issue around the agenda. Honorable Trolley. I don't know whether it's you who has raised a hand or no. There's somebody's hand which is up here. Thank you. I see there's Roland Athol's price iPhone. I don't know whether that's Honorable Trolley, and then there's Honorable Mutusi, and
Yeah, Chairperson, it is me.
Oh, thank you.
I'm sorry, I don't know about the other members, but your connection is really bad. I only get every other word that you're speaking, so it's almost impossible to follow what's going on in the meeting.
Oh, Okay, let me try and just give me colleagues. What about yourself? Am I that bad so that I can change the gadgets?
On my
I
side,
could
not at all.
Okay.
Yeah, clear on my side.
Oh, okay.
The
Honorable
caller is very
Trollip.
clear on the side.
Oh, thank you. It means probably where you are, Honorable Trollip, the issue is on your side because other members can hear me clearly. Yeah, I guess Honorable Trollip has a problem. Honorable Montwedi.
Thank you very much, Chairperson. And since it's the first time we are all meeting, it's good for one to say compliments to
Yes.
everyone here, Chair. But Chairperson, I think let us not move away from the tradition that we have. If there are issues that have to be explained, like you said,
Honorable Montwedi, is that
well
me?
thought, well researched inputs on those documents, on those presentations. So I understand the importance of those issues that the two members would want us to discuss today. But
Yes.
in all fairness, there's a process that has to be followed. Let everything be processed through that process, through that channel. It's an urgent matter that must be discussed. So I want to back with them that let such a process be followed, Chairperson. Thank you very much.
Thank you, Honorable Montwedi. Honorable Mkutama, you had your hand up. You have heard Honorable Montwedi requesting that we look at the item that we have on the table, and that's what I advised Honorable Trollip yesterday through the administration. But here we are now, Honorable Mkutama.
Thank you, Chair, and also let me greet colleagues for this new year. No, Chairperson, I'm happy to follow the process suggested by Honorable Montwedi so that we process these questions accordingly so that we can have them in the next meeting. Thank you.
Thank you very much, Honorable Member. I am worried about Honorable Trollip because he doesn't seem to have a proper network reception where he is. Honorable Trollip, can you indicate if you hear me? Okay. Then we have a challenge, but he will come back. I'm sure he will try and find a way and a place where he can then access network, because I see he is still on the platform. All right, thank you very much, colleagues. Now we are going to stick to the agenda as proposed and prepared. We have amongst us, as I indicated earlier in my comments, Professor I'm trying to sort out I think I must switch gadgets here, colleagues. Just bear with me for a moment. Yeah. So we have amongst us today Professor Costin. We want to welcome you, Professor, and appreciate the fact that you made time to meet with us as the Portfolio Committee on Agriculture. And I see that we also have members of the from the department, and as I indicated earlier on, the director on food safety. So, Professor, you are most welcome, and compliment of the new year. We appreciate having responded and your willingness to come and join us and assist us. I want to believe that you have had in the earlier comments that I made in relation to the reasons why eventually we requested that you come and assist us in terms of understanding of this issue around the organophosphates and the pesticides that had affected a number of people and young children that eventually caused death of those. We will appreciate this. We appreciate this presentation that you are bringing for us. It will help us as a committee to understand further around the issues of food security. As you have heard, we are going to be meeting with the minister and the deputy minister and the department next week. At least by the time they come to present to us the reports of the investigations that they've made, you would have helped us to understand better the issues around food security and the work that you do at the university on the research around food security. Professor, you are welcome to this meeting. We hope that this will not be the first and the last time that you are going to be joining us. I would like to allow you to address the portfolio committee. Thank you.
Thank you very much. I just want to say, may this be a wonderful year, 2025. I never thought we'd get here. And it's a year of great promise. And I just want to say, I just returned from Davos, my first time. And what an incredible event. And I was so proud. Our president was there and 8 ministers and the governors. So we really had a very strong South African presence. I was immensely proud. And a lot of our ministers took part in the different sessions. So South Africa had a voice, and that's very important. And then we lead the G20. So I think this gives us another level of a very strong level to take things forward. Having said all of that, I'm going to take you through this. I've made some slides. I've shared it. I've actually got quite a lot of documents I can share with you. We've recently prepared a food safety article, and then there's quite a lot of information. But I thought I want to start by just putting your mind in a certain thinking pattern. And that's why I thought I'm going to start and I'll watch the time, and you can just remind me when I must stop talking because I can talk too much. But I want to start with a very basic, and that's the basic right of safe, nutritious food for all. And I just want to see if I can get my slides to go forward. And I see, let me just quickly try again.
Prof, I just want to respond to the matter that you raised here on time. Please do feel free to share as much information as you have.
I'll do that.
Thank you.
I would like to just show 2 slides. These slides were recently, last year, December, presented by my postdoc, Dr. Tracy Mwanga, and she works on food safety.
Recording in progress.
And I want to just quickly highlight this as a background. So the basic definition of food security, I think there's many definitions. This is, for instance, the World FAO one. But it's about access, availability, nutritional value, affordability, and stability over time. But the reality if it's not safe, it's not food. And that's a global accepted statement. That's the first point I want to raise. Then what's also very important, the issue around social justice. And if we look at the reality of inequalities in South Africa and the number of people in our country experiencing food insecurity, who are food insecure, then it can be considered, and if you look at global standards and norms, it is a crime against humanity that there's people who's hungry, children that's malnourished or stunted. And you know, South Africa is the one country in the continent that's nationally food secure, but at a local, at home level, food insecure. So this is a priority, my first point. And my second point that I want to make, just going back to relevance and human rights, is the right to food. So everyone has the right to the right to have access to food. And then there is a focus on particularly certain groups, such as women and children and the elderly, etc., that's adversely affected by hunger and food insecurity. So if you add food safety challenges on top of it, it's really an inhumane thing to expect people who's already suffering at that level to be exposed to that as well. So it's really a very important aspect for me. And this was just a summary from Tracy, and she's published some papers and prepared documents, and she just basically looked at the right to food within South African law. So, and it's enshrined in the Constitution, etc., etc. So we do have made provisions for this. That's one part of the picture. The other part of the picture, before we talk about the chemical and the contamination and the deaths, is just to put South Africa in perspective. And I'm going to show a few slides around this. Because we have a dualistic system. So the top layer of this reflects the formal, highly regulated sector. And it's based on self-regulation. It's the commercial farmers, the big packhouses or processing plants, and the big retailers. In total contrast, we have this growing informal sector where we have small-scale farmers and then informal trade. And I think when we look at food safety and food challenges around nutritious safe food, we have to think dualistic. Because at the top layer, they provide food security for the country. At the bottom layer, they provide food for all. But how safe is that food? So what I've done in this slide was just to give you a summary. And I try to highlight in the top layers, I hope you can just follow me on that. I can maybe try and just get a pointer. But I want to emphasize that the top layer, the commercial sector, is very much a self-regulatory system. If they do not comply with HACCP or GAP or Global GAP or BRC or whichever standard or a retailer-specific standard, they will not sell their product. Some of their product may go into the local fresh produce market, and I'm going to use fresh produce to explain my story. Then I'm going to move over to food, and then I'll go into the pesticides. So what we have here is the only big challenge we have in this top layer is really irrigation water, which is not currently in our country fit for purpose. So this, to me, is a priority that should be addressed with Department of Water Affairs. And I know it's been spoken, Water Research Commission. We are doing projects for them on this. We're actually busy developing a fit for purpose model for them. So we know the water is a problem in the commercial sector. We do know the commercial sector has an effective cold chain management system. They can move produce effectively from a farm to your table or to the retail point where you sustain the cold chain. You don't have breaks in the cold chain. During load shedding, we did have some challenges. They also have perhaps more waste on the end of this chain and less on the farm. But they do have effective waste removal at the end of this long chain from the commercial sector. But if you take the duration from the farm to the time that it gets to the point of retail, for instance, with lettuce, that can be 7 days. Comparing that to the bottom, which is the informal sector, the chains are very short. We found in our studies that a chain from farm to the point of sale can be, or consumption actually, we followed it into the informal housing system, could be 2 days. So it's a very short chain. It's not in a cold chain system, so it is exposed to temperature extremes. They also have a challenge around contaminated irrigation water. Then they have no regulated system. And this is something we should consider, developing more effective, more fit for purpose systems for small farmers. And I'm talking about very small, even from household level all the way up, that people understand the basics of when you have a pesticide on your farm, you can't store it where you store the seeds or where you store the food. Because the layer at the top, the commercial sector, they know and understand how to work with pesticides. So at the end of my presentation, I want to make it clear, let's not kill the goose that laid the golden egg. The commercial sector and the chemical industry should not be blamed or taken down for this current situation. We should rather learn from them and apply it and support the smaller farmers and the smaller retailers and traders. So that would be my big call, because they also have an irrigation problem, but they don't have access to smaller pesticide packages. They don't have often access to spray clothing, protective clothing. They don't have access to training, how to use it, how to store it. Then there is a public or commercial responsibility, and there is a responsibility to take this message to every single person. In fact, I want to say we should bring it into the school curriculum. What is a chemical? How do you store a chemical? Why is it dangerous to touch it or play with it or contaminate a surface? Everyone should know, because everyone's got a little kitchen somewhere or a big kitchen, and you do have chemical cleaning agents. Sometimes you have poisons in your house for rats, etc. Every citizen should take a responsibility to know and to understand the importance of chemicals, how to use it and how not to use it, and how to store it. So that's to me a very important point. And I would rather focus my presentation that how do we get there? So this bottom layer has no control. So they have no access to continuous effective training, awareness programs, and we need to focus on that, and we need to see how can we unlock that. They also sit with a lot of farm waste. We have done extensive studies on the small and commercial farm supply chains. They don't have hygiene and sanitation programs. Hand washing or cleaning a surface, that knowledge is not there. They're not empowered, and they don't have access to those chemicals. And they don't have access to potable water. They don't have access to ablution facilities. And they do not understand the concept of prerequisite programs, which is a critical primary requirement for any food premise. You have to have prerequisite programs before you can handle food, process food, prepare food, sell food. We must make sure we take this to the school curriculum, that everybody knows about this. You've got to wash your hands. You've got to keep your surfaces clean. You've got to wash your plates. Why do you have to wash it? How do you do it? This, to me, is very important. So they also don't have, in the informal sector, access to waste removal. So with that, you get away a buildup of waste, and you will get rats, cockroaches, and that's part of a pest control program that any factory or processing plant or farm or building has. We all have pest traps in our buildings to manage and control cockroaches and rats. Why can't we help and enable the informal sector that is growing to do that? Because I believe that's a solution, and that's what we should focus on. So I just want to say, if I could say anything, a priority, a national priority, is the irrigation water. Secondly, we need to look at sustainability. And if we look at the formal sector, I believe we need to get them more involved in the informal sector to help. I believe we should also get them more involved to focus on food donations where food is most needed. And I believe they must be more involved with contributing to the national food security strategy. And they must contribute towards changing people's mindset about food. I want to say to you very clearly, food must be seen as an important asset for us in terms of achieving health and well-being. People should not be exposed to not nutritious food, to junk food, to fast food. We should make sure and embed it in everyone's mind that I would rather take an apple or a pear that will be the same 5 cents or 1 rand than take a packet of chips or drink a Coca-Cola. We must change the people's mindsets. I think it's so important, and we must include the industry to help us with that. So from a nutrition point of view, I'm very adamant about this. Then for the informal sector at the bottom, I believe we should expand. We do have some under Department of Agriculture, under Department of Health, there is activities, but there's not enough capacity. We should expand. We should be more involved in education and training. It's everyone's responsibility, not only the government's responsibility. It's my personal responsibility wherever I go, wherever my students go. So we all must engage in helping to empower this informal sector. And we must help them with waste processing. Help them to reduce the waste, to better manage diseases and pests. If they know how to better manage it, we will have less fungicides, pesticide residues on the food commodity at the end. We'll have less risk of contamination. So I also believe in the food sector at the bottom, the informal sector, they also don't have good distribution practices. We have been monitoring the chain from small-scale farmers, and the trucks, sometimes they have cows on it, sometimes there's a sheep on it, sometimes there's lettuce on it, and that's not fit. Then it can't be fit for human consumption. People must understand that if you transport it in a bakkie or a basket or a trolley, or you put it out on a table, it has to be clean. And that requires providing people with adequate training and education and awareness. And I think it's so important. And of course, registration of these facilities where they do sell food, not only fresh produce, but all food items, and having regular inspections. So I was recently at the Davos, I spoke to Thailand, and they sponsored one day's lunch, and the food was incredible. And I asked the president and minister was there, and I said to them, we have such a challenge in South Africa with our informal sector. We need to make the food more tasty, nutritious, and safe. And I said, how do you do? Because everyone in Thailand eat on the street. People love their food. It's good. It's safe. And he said 2 things. He said consumer awareness. He said use platforms so consumers can talk to each other. They know exactly where is the best street food for this or that dish. And it's a branding. It becomes a culture in your country to be proud of your food, how you prepare it and how you serve it and how you consume it. And that people in Thailand focus on good nutrition. They understand hygiene. And then he said on top of that, from a government point of view, we just regulate them. We have our annual inspection of these food selling premises, and we do some training. But there was a big emphasis in Thailand on consumer awareness. So for me, that's a very important aspect. So I've taken that same supply chain and I've made 2 blocks to illustrate what I think should be the key focus so that we can take from the formal food system. That is really, besides the Listeria outbreak, we haven't had a lot of outbreaks. We haven't had a lot of product recalls. Yes, we recently had the fruit juice, the apple juice recall. We recently had the peanut butter recall. And what it does show, we've got traceability, we've got effective recall systems in place. They can do it. They can remove the food and destroy it. It's very important, the destruction, that food doesn't go loop back into the food circle, into the informal sector. We must prevent that. So if I look at the commercial food production, the local food processing, and the food imports, and now I'm talking food, not only I'm talking the biscuits or the canned food, all food items. There is effective control at the ports and borders. Department of Health is working. We have mapped 20 years ago, we mapped the whole food chain. We looked at the systems, we advised on where to improve. I believe we should go back to those documents and review them, revise them, and add the informal sector, because I believe that's where our problems come in, is the illegal movement of food, where the people import it or move it across borders, whether it's food that's maybe stolen or written off or supposed to have been destroyed, which found its way back into the food system. But those food items end up in the informal sector. And that's what we must prevent. And if we can get all consumers to help us manage this system at the bottom, and we can focus on food production, food processing, and managing the movement of food in this informal sector, I believe we would have done a lot. So there is so-called stores or spaza shops or street little, I call them pavement shops or street traders. There's many terminologies that we have. There's some that's registered, some is not registered. I believe we should have a strategy and a map and maybe apps. And there's so many amazing tools today that we can use to help this sector at the bottom so that we can have more effective food distribution and we can have safer, quality, nutritious food, particularly because the consumer at this bottom cycle is often the lower income groups who do not have medical aids. They don't have a vehicle to go to a hospital. They have to purchase food nearby. They can't buy big volumes. They have to buy small volumes. They often don't have enough money. So we have to think differently about how we manage and control our food systems. Now, I think the big thing for me in the informal sector is the traceability, the lack of it, the lack of accountability, I call it counterfeit goods, the lack of labeling, which is exactly what we found in this case, the expired food that moves through this system. Keeping in mind that people don't have big volumes, they have to buy those smaller volumes of food, and they often end up having no choice but to buy an unlabeled product. So I think it's extremely important that we help them and enable them and make sure that the most vulnerable of the population will be protected and that they are empowered. So I want to just now move on with my presentation and I think we've all seen these maps of food security. There is a food safety index that we are working on. But if you go into the food security index, and there's a more updated version, and there's USDA is working on it, FAO. We have a Food Safety for Africa initiative where we're also busy mapping all the countries in Africa. And we can go and do a food safety assessment for the formal and informal sector. So there's so many tools today. And I will end my talk with some of the work that we are doing that I think could help. So I just want to touch on the spaza shops more specifically. Most of our research has focused the last 10 years on the informal sector and small farms. The previous 20 years work was mainly on the commercial sector, and with the Centre of Excellence, we shifted our attention to the informal sector. So this is a very important part of our community, and I want to just touch on the timeline of events, the chemical links to the. I just want to touch on this. As you say, official reports will still be coming. And I want to then just also at the end make some suggestions on what I think. But I think there's a few important statements that has been made. And I think there's a few important terminologies that we should maybe use to get to use for communication, whether it's food poisoning, food contamination, food safety. And if we're using AI tools at the moment to unpack all these reports for us. We're busy writing a review on all of this. And we were just looking at how the informal or the research platforms and the non-research platforms were absorbing this information and the terminology used, because that becomes extremely important at the end to better understand, to track and trace, and most important, to find the origin of this and to ensure that this does not help. So we have lots of statistics coming out, lots of little bits of newspaper reports on the number of deaths. There was a very good study done at Cape Town University over the last 5 years where they've been tracking deaths associated with pesticide or chemicals in food, food poisonings. And I think that's the kind of information we need to pull out. This is just some of the data, just to give a little bit of perspective. So it really is a big problem in Gauteng. But it doesn't mean that other provinces are free. Mpumalanga and KwaZulu-Natal also carry a high burden of losses and cases. And if you look at specifically then Gauteng, Ekurhuleni was also severely affected. So we do have our hotspots or areas where we do have more reports, more cases. It can be that more is reported, but overall we do have some statistics emerging, and we have started creating these tables to see how many deaths, how many hospitalizations. And it's a common phenomenon to see these big packets of chips repacked. It's a common practice. My students have done questionnaires and interviews in these informal sector and at the spaza shops. There was a brilliant study done 5 years ago, mapping, and we also took part in it, looking at pesticide residue on the produce. One of our group looked at mycotoxin levels, and then the others just looked at the kind of produce traded, the labeling, counterfeit goods, and mapping all the informal sectors. So there's this really incredible information, and perhaps it will be good to create this knowledge platform where we can put this information so that it's accessible to all. And I will say something at the end. So a little packet like that is something a little kid can buy, or someone after school. They're hungry and they need something, but that to me is not food. It's full of colorants, full of chemicals. It's got extreme low nutritional value. But if you're hungry, you need to eat. And we need to change people's mind. There should rather be apples being sold and bananas. We have apples and bananas and citrus, and we have it. It's not that expensive. We should make it more accessible to all. And that's why I want the commercial sector to be pulled into this strategy. So, yes, we can also look at the definitions. World Health Organization, their definition around what is food safety, and of course, what is food contamination. And we know in terms of the food contamination and food safety that we do categorize it under biological and chemical. And within the context of chemical, we often speak about pesticide residue or maximum residue levels, where we measure the level of active ingredients still present on that food product. The same with mycotoxin levels in grains, in the peanut butter case. At what stage does the peanuts or the groundnuts get contaminated? And interesting parts of our studies were a lot of it's because of field handling practices and the distribution, where these bags of groundnuts will stand covered in plastic, and then you get the fungi growing, and by the time they reach the processor, you already have quite high levels of toxins. And they're often tested at the end of the chain. And then whatever they reject, we don't always know what happens with that food product. And that's often what gets moved into the informal market. And that's what we have to stop and better regulate. So, and then there has been so many brilliant studies done. Some of these slides come from Department of Health. Or I work a lot with World Health Organization. We work with FAO. We sit on their expert committees. We are developing best practice models. And we are looking at what they are using. And I know government has systems in place. And how can we connect all of this? So just stepping back to the chemicals that's in our food, most of it is exposed to the food and can happen during production, even processing food items, transport or storage. And to me, this was a classic case of cross-contamination. And I think we know more or less how the story unfolded. But we should also look at a lot of the classic studies that's been done, not only in the mycotoxins, but I know, for instance, mercury in fish. There's really interesting work coming out. And once again, it's very interesting to pull lessons from these different disciplines. And then, of course, within food production itself, you have, for instance, many chemicals. There's the oils during the baking and reusing of oils, etc., etc. And all of this cluster under how it affects the health and well-being of the population. So, and there's a lot of statistics currently, and this is just an old slide, but just to show you that I almost feel nothing has changed. We still sit with the same hazards, more or less the same numbers of deaths annually, shifting a little bit from country to country. But I don't think we are making a big shift. We now have climate change that's on top of all of it, that will drive all of this even more. So I'm just going to mention a lot of this. There's a lot of information. I'm not going into this, how we do the hazard classification for pesticides. And these are well described. They're used by Department of Agriculture, the registrar for the chemicals, the pesticides. And there's also from Department of Health, a lot of work that's been done in South Africa, globally in Africa, particularly, for instance, on aflatoxin. We know that there's been the investigation into the spaza shop, and that is already, there has been a statement around poor waste management. We know that. You can see it. We know there's no ablution facilities. We know that will attract pests, rats, cockroaches. And I feel we need to focus on those pillars. Let's fix that first. I know there's issues around the unregulated pesticide use, but I'll talk about the pesticides just now, but I want to caution the decision around having a blanket approach of just banning pesticides without thinking of the food security impact it will have. We already, as it is, battle to get chemicals registered for commercial use in agriculture. And we will not be able to produce enough food if we do not have adequate pesticides to protect our crops, and particularly with climate change. We also have an incredible buildup of fungicide resistance with existing fungicides they're spraying, to give an example. We also have an incredible buildup of antimicrobial resistance, which is not necessarily linked to the agricultural pesticide plant health section. It's more related to animal health and then human health, with waste going in, antibiotic residues into the wastewater, into our river system. So we have a buildup of antimicrobial resistance. And that's currently a big focus area. So we have a lot of big tasks to do out there. And I think we need to start with the simple things that we can easily, the low-hanging fruit, that we can easily and quickly change and address. We need to have adequate food safety standards fit for purpose for the informal street vendors. And we must make sure that everyone needs to know how to use any chemical for that matter. So yes, the story unfolded around the chips, the children that died, the traces of these chemicals, and that these products were repacked, and it's during that repacking process that the cross-contamination happened. The pesticide should never have been sold. It wasn't labeled, traded. The people using it or exposed to it, they're not trained. They don't know how to handle it, store it. So that, to me, is the crux of the story. And we need to help them manage their environment. They need a healthy, safe environment. So just to touch a little bit on the chemicals, the turbophos, which there's a lot of information. It's obviously an organophosphate. It's a very important soil insecticide for instance, nematodes. And, being in plant health personally, as my training, every chemical we remove weakens our crop protection strategy. We cannot totally go organic. We will not be able to have enough food. We will lose too much. The food waste will be incredible. So we need to ensure we have healthy soil, clean water, healthy crops, manage through integrated pest management systems our pests and diseases. And I think this is extremely important. So, and then the big issue is it's been illegally sold. So how did it get into the country? I truly believe it is not any of the big chemical companies. The Bayers and Syngentas, they have very highly trained agents selling their products, and it's sold to people who's registered, people who buy these fungicides. They get audited, they store it, they lock it, the high red band products. They have training records to show how their workers have been trained to have protective clothing. They are doing as much as they can. They use responsible application methods. So I really want to say that we have a regulator, we have a system in place, and I'll mention something about this at the end again. But yes, it has been linked to death. It has carcinogenic potential. But I think we need to find out who is selling it. How does it get into the country? How does it move through the country? And then the same with Aldicarb, which once again, same story. It's also a nematicide, and it's also categorized under organophosphates and important potato production. So sometimes these products that's no longer registered in the country is still flowing around globally or in the continent and find their way through a porous border into our agricultural sector. So it's not always 100% foolproof system. Farmers know what is a banned substance. They know when they can spray, how much they can spray, when they need to stop spraying. Most of their produce will get tested, but it's that unregulated system that I think is a bigger threat. So yes, one can once again summarize and look at the statistics. I'm just reflecting on some of the reports, some of the news groups on what is legally registered still in use, and the strategy, what should be done going forward with these chemicals, I believe is part of a discussion where we need to bring everyone on board. The industry, particularly the chemical industry, the commercial sector, the retailers, government, and all the scientists. And we need to really put forward a fit-for-purpose strategy for South Africa. So, so far we know that some of those shops were closed. That was linked to the deaths. We know that we have more environmental health officers that's been going around inspecting these spaza shops. There's many videos going around. I have really nice videos of people quickly going from the spaza shops, dumping their stuff illegally, and then you see how people quickly come and take the stuff that's been dumped. So the stuff is still in circulation. And it's a matter of how do we get it out of circulation as quickly as possible. And I believe, how do we quickly increase the number of inspectors on the ground? So 20 years ago, I did this study for the country profile on the food control systems. And at that stage, we already said South Africa didn't have enough inspectors. We need to train more environmental health officers. We need to expand that. So both Department of Health and Department of Agriculture, we need to expand their capacity. And I think it's extremely important. And then we need to go to Department of Education and work on the curriculum. We've been mapping the school curriculum There is some things in about food safety. We've been trying to map all of it, to look at what's happening in other countries, and what level of education can we take to a primary school or a high school, and help with the school feeding schemes that we ensure that children are not exposed to chemical food that's not safe. And then, of course, there's the declaration from our president, the national disaster, and then the fund that was launched. And I think there's really a national concern and commitment from everyone to help address this, to come with a proposal. Now, I want to share with you 2 slides. It's very old. I pulled this out of my collection. I think I did this slide in 2001. Or the study was done in 1999 or something. But we proposed at that stage, it was a study done for Department of Trade and Industry, Department of Health, Department of Agriculture, to develop a food safety authority for South Africa. And we looked at different models. I remember at the time, I mapped all the different countries and how they manage their food system. We looked at the USA, the Irish systems, etc., whether it should be like a food safety agency, like a Company 21 concept, or should it just be a coordinating body or committee, or should it have more regulatory powers? With other words, put it under the president's office, or do we have under a minister a national food control, the food safety department specifically linking health and agriculture, etc., etc. So we did put different models on the table. We extensively discussed it at the time. And this is still old, so I think it's still the old department names. But we looked at how could we possibly pack a food control authority for the country. That would be a best practices model. So we have done, I think it's good to revisit this in the light of the current outbreak and the fact that we've been through listeria. And this was also a model we developed. This was actually the PhD thesis of Thomas Matwinga. And what we did, we analyzed pesticide residues on all food crops in South Africa. We took 6 years data and analyzed it. Now, this thesis was 2016. It might be a very good idea to go back and revisit this and see what has happened since. But what I can tell you, of the export produce, we were the country with the highest compliance in the world. With other words, the food we export is safe. It complies with our MRL standards. But we found a lower level of compliance with food that's imported or that's locally circulated. So if we can do that for export, we can do that for our own local food. And that's very important. I remember at the time, at the end of his thesis, we developed like a model. How can we integrate and more effectively streamline the pesticide, the regulation of pesticides? And we were looking at, for instance, the laboratory, the toxicity assessment, residue analysis. We were looking at pest risk assessment. How many pest risk specialists do we have in the country? Currently, we're training 1 PhD in that, Tabang, and we don't have enough capacity in terms of that. So we really need to build capacity. These are scarce skills. We have a gap in our country, and we must prioritize it. So we were just looking at the environmental impact studies, MRLs, the role of Department of Health, the role of CASA, CropLife. We can add to this what has in the meantime happened. We have a South African Biomanufacturers Association. I was the founding member of it. With Televali was still there, I remember. And we now provide a platform to help regulate biological agents, plant growth promotion, or biological control agents. So it's been added to this model. This was just quite an old model. So I just wanted to explain that a lot of work has been done. We need to maybe revisit some, but I think we need to assess the information we have. And then I want to touch on where are we now? And we've been very active in creating transdisciplinary teams and linking these silos. So people tend to work in either human health or animal health. So the One Health concept developed very nicely. But every time we have a One Health discussion, plant health is almost forgotten, or they group it under environmental health. And food safety is not even included in those discussions. And last year we had the Global One Health Conference, and I made sure that I invited our Department of Agriculture, Plant Health Inspectorate, and Plant Health specialists, and also the International Plant Protection Convention. They were present, and several speakers. And we also put the emphasis on food safety. So we believe that unless we integrate these knowledge packages, we will not get a holistic solution for our country. Soil health is in Africa now such an important issue. Soil restoration, water security. I mentioned the water pollution levels, the critical crisis of our water, the state of our water, the need to ensure food security for all, the incredible gap in having adequate biosecurity capacity in our country. That's critical for us to protect the food, the people. It's not only about One Health, it's also about pests and diseases moving. And then, of course, climate change driving this emerging and re-emerging pathogens, the increased chemical contamination. If we can get a house in order, we will address human rights, we will ensure dignity for all, we can grow trade, and we can create jobs. And we should use AI. We have these new tools, and I will show you some of the tools we're using to really help us and fast track us with some of these knowledge packages. We have, for instance, looked at circular sciences to bring, and I call it water sovereignty, to bring the water issues together, to look at the right to water, water best practices. We're working very closely with Department of Water Research Commission, also in terms of water policy, water regulation, water governance, linking the community of sciences, looking at roof harvested water to be used for crop growth or washing. And I think these are important initiatives taking us forward. We also, in the case of our specific research group, has been working closely with the World Health Organization and FAO, and also focusing on these One Health approach and increasing the surveillance capacity. We must increase surveillance, border surveillance in terms of water. AMR, for instance, we really have a lot of work to do. So I want to end with just the last few slides. We have a big water plant food interface section. We're publishing a lot of good information using knowledge gaps. And we've published some of our metadata analysis work. We work very closely with FIO, Codex, and WHO. We, for instance, were part of these risk assessment studies that we've done. And we made sure that the African needs were addressed, and specifically looking at farm to fork risk assessment. And this is typical, some of the studies we've done recently. I was part of this team that developed a new fit for purpose for fresh produce. And it's currently, I think, at Codex level. And we based it on science. These were some of the new guidelines that I was involved with. So there is a lot coming internationally. And we need to, from the ground up, link that we can empower our scientists and searchers, government, and support industry. A very big focus on water must be fit for purpose and must be potable and be accessible to all. This is just some of our studies on multi-drug resistance, showing traceability, how we can actually map where things coming from. We monitor genes, virulence genes or antimicrobial resistance genes, and we look at this whole food chain from the water, the crops. We look at animal waste, animal husbandry waste. We've looked at pig farms. We look at several other poultry farms and the effluent going into the rivers, and then we trace it all the way back up to the plate of the consumer. We have the tools now. We can do whole genome sequencing, and this really provides us very effective tools going forward. This is a study where we compared E. coli and Salmonella, and we compared all our data with what's happening in the rest of Africa. And we are trying to develop indexes. And I want to share with you, this is a brilliant paper. This is a paper written by David Graham, and he used a lot of Chinese scientists to help him analyze the metadata. And he took all the data globally, 3,000 publications. He ended up screening, but he started with 220,000 that he filtered. And what he found was the increase in scientific publications, and you can see in the middle the graph, increasing from 2015, 2020. From then onwards, we've had incredible output in terms of science, but the majority of it is focusing on human health. Very little is focusing on plant health or food systems and the environment. And therefore, we made the argument, I'm working in a project with them, that more funding should be provided to push into plant health and environmental health and food systems. It also shows the lack in this last figure at the bottom, C, and those are least developed countries. You can see the number of publications coming out of those countries. So we have a knowledge gap, and we are trying to convince global funders to put funding in towards helping us to develop this. My last slide is just to look at using AI tools. We have a big Food Safety for Africa project where we develop these AI tools, and we are putting all data into it so we could map food safety issues so that we have a better understanding of food safety in the informal sector. We're gathering all data. We've mapped, for instance, all patents, all thesis publications, informal websites, and we want to make sure that we make all the knowledge available, absorbable, usable, and accessible to all. And that includes connecting experts, professionals, and creating a platform. So we have these search engines that's running, and I think this is a very important platform to support, because it enables us to rapidly go through information. Just to give you an idea, we have 1 billion articles in this database already that we're pumping in so that we can better understand what's happening to provide better solutions. So my final slides, if I still have more time, we mapped the training. Who's doing what training in South Africa in food safety? And these are the universities, and this is the kind of degrees they offer. So TUT, for instance, they often train a lot of the environmental health inspectors, as well as Kaput and also the Free State Technikon. And then we were looking at who's doing research, but most importantly, which courses do they offer and what is in the courses. So we could see who offered, for instance, HACCP or good manufacturing practices, legal requirements, cleaning and sanitation, hygiene practices. Is there any of these courses that we can use? We have, for instance, mapped what's available in Africa, who's doing risk assessments, who's doing food safety management. So these are the countries in Africa, and there's only 4 programs, so it's not a lot. And then we mapped it globally. Who's the leaders globally in training in food safety? And what are they training at? And the strongest is Gulf University. McGill is very good. Michigan is very good. And then Wageningen, outstanding. I mean, a lot of publications coming from them. Nairobi is also active. We should be leading at this level. And we then mapped what are they covering in their different Courses, we looked at, do they offer biosecurity? Do they do food safety, quality assurance, inspecting, auditing? What are they offering in these different courses? And we then created a new platform with Leeds University where we will use some of these top scientists to help train people. So we develop training material for food safety. And I believe that's the way forward, to open up the information, open science, and empower every man in the street to make an informed decision. I want to leave you with 5 messages. We need to develop a robust regulatory framework for food safety, and it must be effectively communicated to all. It must be fairly implemented and enforced by appropriate entities with the necessary training. And that is very important. We must develop a fit for purpose food safety policy. We have a food security policy, and food safety is always mixed under nutrition. And it's not nutrition, it's more than that. And then we need, I believe, a food safety authority or a framework that brings everyone together. We need open data source platforms. We're busy negotiating with the Wageningen. I actually also went to China. I spoke to them to look at how do they manage these open data source platforms. Can we develop something for Africa that will fit for us, uniquely South African? We've spoken to Department of Science and Innovation on this. And then we must develop capacity, inspectors, technicians for the labs, researchers, risk assessors, etc., etc. And then we must build testing capacity. We have a very good concept of modular and mobile laboratories. These can very rapidly be put up and moved around, and they can be regularly fitted. And I believe we can benchmark methods so that we can improve surveillance. So I also think, very importantly, we must have a National Food Research Institute, and we hope to attract funding to put something like this on the table for South Africa. And from my side, we do have a lot of references and statistics around deaths, etc. And I think I can stop now.
Thank you very much, Professor, for the presentation. I hope that you would like to see the face of the person that is talking to you, especially that you switched on your video so that we can relate to the person who's talking to us. I hope that members can hear me. I see that Honorable Trolley still struggling with the hearing or following the meeting. So, Prof, thank you very much once more for the presentation that we've made. I also want to welcome the DG. I think the DG has joined us, and the other members of the department that have joined us this morning. I already want to invite hands to interact with the presentation that we've made, Professor. I have Honorable Mntwedi and I second Honorable Trolley. Honorable Mntwedi, you'll be the first, and then the third one is going to be Honorable Mngxitama.
All right. Thank you very much, Chairperson. And let me welcome and thank the professor for the very detailed presentation. 3 or 4 things on my side, Chair, is on the issue that the professor has mentioned, that the irrigation water not fit for purpose. And I fully agree with the professor, because at some instances I've interacted with a number of farmers who raised serious concern with the highest levels of pH in the irrigation water, which some of them is actually not good for our plants. Now, we're not just talking about irrigation water, Professor, coming from rain harvested water. We're talking about irrigation waters coming from water boards that are regulated. These water boards being an entity of the Department of Water and Sanitation. Now, as part, Professor, of creating, as you say there, a fit for purpose, a system for irrigation water, have you tried to take this matter up with the relevant department, your DWS, or, I mean the Department of Water and Sanitation, or any other relevant authority, and what has the feedback been? And that report, Professor, where there was a conclusion that the irrigation water is not fit for purpose, has that also been shared with the Department of Agriculture? Because those irrigation boards are actually supporting the sector. And is it generally all the irrigation water
Yes.
in the country, or is it some parts of the country where the irrigation water is not fit for purpose? So that is the first thing. And lastly, maybe on that matter, how do you think that can be addressed, that irrigation water that is not fit for purpose? The other thing, Professor, and Chair, through you, Chair, on the issue on the handling of chemicals, you made a proposal that handling and dealing with the chemicals should be added to the school curriculum. Now, I want to challenge you there, Professor, to say, why are we not saying agriculture as a subject should be added to the school curriculum with handling and using of my apologies, Chair, am I still audible?
Yeah.
Yes, you are, but we skip some of the words. So please try and find a very stable area.
No, my apologies. Chair, I got distracted there, but I'm saying, why can't the professor propose agriculture as a subject to be added with handling and dealing with chemicals as part of that curriculum? So that, because agriculture is important, that we also add it there. That is the second issue. The third issue, Chair, is about health and safety in farms. The professor raised that thing, and there was a visit by the Portfolio Committee of Agriculture in the sixth Parliament. This is the seventh, in the sixth Parliament, where visits were done to a number of farms on the living and working conditions of the farm workers and farm dwellers, where some of the farmers refused entry to the Portfolio Committee in their farms because the situation, it means it was far worse than that. So as an organization, Professor, we agree with you that the living and the working conditions of farm workers and farm dwellers need serious attention. But I want to ask you, Professor, how do you think as Parliament we can deal with this matter as lawmakers in terms of making sure that we deal with the living and working conditions of farm workers and farm dwellers there? The last two issues on my side, Chair, is that what is your impression, Prof, of the role played by government in dealing with these challenges? And I'm saying this because it's been for some time, the country is also losing a lot of revenue because some of these things are just fake stuff that are being brought into the country that finds itself in rural villages, poisoning our people there, where there at times a number of undetected issues to actually link some of the deaths that are happening into our communities there. How do you think government is actually dealing with this thing? And I'm saying this because there's a lot of alcohol that is fake doing rounds. There's a lot of cigarettes where you find them only in spaza shops. But if you go to your ShopRite or any other stores, you can't find them. Do you think government is doing enough in dealing with this problem? Because this problem affects health of our people. This problem affects our country, where we are unable to earn a revenue from them, because some of these things just happen when people bring fake stuff in the country. With that, Chair, I think those are my few contributions, but thanks very much, Professor, for a very clear and detailed presentation. Thanks, Chairperson, for the opportunity given to raise these issues.
Thank you, Honorable Mutedi. We do appreciate that. The next is Honorable Trollip. I hope that Honorable Trollip, you now have you are at a place where you can hear us properly.
Yeah, thank you very much, Chairperson. I must say I was frustrated initially because I'm in Parliament and the parliamentary systems were very unstable. But I want to thank the committee and the professor for submitting the slides beforehand, because even though I couldn't hear the presentation, I could go through the presentation. Yes. And I just wanted to make comments around 3 areas. First of all, the professor spoke extensively about water quality not being fit for purpose, and that quality of our water is a national crisis. Now, I think this is a very, very important point, because almost all of our water courses are contaminated with sewage in South Africa. And I don't think we're saying enough about that because of the dysfunctionality of water treatment plants. The professor also spoke about contamination from large commercial enterprises like poultry, piggery, and dairy operations. They also contaminate water courses. But pollution of our water makes our agricultural food production compromised. And it's something that we're going to have to do a lot more about, because soon it's going to have an impact on export products as well. Global gap compliance are very stringent. And, there's a lot of trade barriers being put up in Europe around South African perishable products being exported. And all they need to do is to find a number of consignments contaminated with E. coli or regular E. coli contamination, and they will stop exportation. But what concerns me even more is that our local food production is not regulated, and it requires much more regulation. But the reality around regulation for export compliance is that the cost of compliance is very expensive. You've got to record every chemical you use. You've got to ensure that the people using the chemicals are trained, disposal of chemical containers not being reused, which is a big issue in South Africa. So we need to be very aware as a committee that we need to be a lot more compliant, and that with compliance comes additional costs, that people sometimes like to take shortcuts, and it's a very short-sighted attitude, but it does save costs and therefore compromises food quality. And then, Chair, I would like to hear a little bit more around the legislative environment regarding decanting of food. I'll tell you why this is a major problem, because in poor communities, people who can't afford let's say a 12.5 kg of bread, flour, or mealie meal often buy it in smaller quantities. Sugar, for example, is decanted from 1 kg into 250 milligrams or whatever, because people just can't afford it. So you see everything at informal spaza level being decanted. And this is where contamination occurs, and also serious price exploitation, because people might not be able to afford a kilogram of sugar, but they're buying 250 grams of sugar at the value of about 750 grams worth of sugar. But they might have 3 Rand to buy sugar, but they don't have 10 Rand to buy sugar. So this is an area of massive concern, and we should be regulating the decanting of food or the packaging of food, because once you start doing that, the levels of contamination or exposure to contamination are increased quite significantly. And then my last comment around AI. AI is a wonderful tool. It becomes the extension of your arm. It's in your pocket, on your cell phone, on your laptop. But if there isn't adequate support, technical and advisory support and extension support, people can inadvertently be using chemicals in a fashion that increases contamination and doesn't control contamination. So we need to make sure that there is proper, trained and competent extension and technical support in food production and certainly in agriculture. And I know that we as a committee talk a lot about that, but we're going to have to stop talking about it sometime and making sure that people that are in the field helping people, especially in the informal food production sector and compliance in the commercial food production sector, are using these chemicals properly and not, compounding our challenges around food safety and food security. So I really appreciate the input, but we as a committee, I think, are going to have to apply our minds much more significantly to ensure that we don't have the deaths that we experienced last year. Thank you very much.
Thank you, Honorable Trollip. Honorable Mkutama.
Thanks, Chair. And let me also say thank to the professor for a very comprehensive presentation. And now I just have two issues. The first, and perhaps I'm just burdening the professor for a matter that she's not competent to comment on. The crisis of food poisoning, which was specifically to food found in spaza shops, is a matter that must be properly ventilated. How did this chemical get into the food system only for spaza shops and not any other food retailers? The big food retailers were not affected. Why is it that spaza shops are the only ones where we find these problems? I raised this issue, and unfortunately, Dr. Van Vuuren doesn't want to talk on the reports that were made under his name, because there he was beginning to suggest a bigger conspiracy, which has to do with the 20 billion rand industry of a spaza shop, 200 billion rather, and the contestation there for possibly space. So that's just a speculation, but it might have been giving direction to what caused this food poisoning into a very specific area. Now, let me conclude, Chair, by saying that I do think the proposal for an authority to look after the food safety is a very important proposal made by the professor. I just want to add that it must be an independent authority. It must not have industry members there, because this is the problem, that these industries are self-regulating and we end up with these sorts of problems. Thanks, Chair.
Thank you, Honorable Mkutama. Honorable Lucas.
Good morning, Chairperson, and good morning to everyone. I also would love to wish you all the best for this new year, and also thank you very much to Professor for the very, very comprehensive presentation. Chairperson, mine is only on two issues, and that is on, first and foremost, the issue of the regulatory framework, because I think particularly on the issue of informal traders in spaza shops, and also the role of local government or the municipalities in this instance, where we would need to actually begin to assess and evaluate the regulatory framework, and how do we make sure that there is a coordinated approach with regards thereto. Because if you look into the issues that is being raised with regards to issues of water, issues of contamination in all aspects of food provision, then we are sitting with a severe lack of making sure that there is the control environment to make sure that we do have like a safe environment for food production, or also for food distribution, particularly because she also spoke about the transport network and also the way things are being transported and how we actually regulate the issues of transporting fruit through to and from markets and to export points and wherever. So it seems as if we have got a challenge with regards to how do we make sure that there is coordination with regards to regulatory framework and to make sure that there is an environment within which safe distribution or safe consumption of food can take place. So I think what I want in this aspect to know from the professor, how far have we actually progressed with regards to making sure that, particularly after the challenges that we have experienced, how are we going to make sure that there is an regulatory environment within which we can secure that there is food safety besides the issues of food security? That is the one issue that I wanted to raise. And then also the issue of consumer awareness. It's a very important point that was raised by the professor in the context of South Africa, consumer awareness. And because in many instances you find that in South Africa, when you actually complain about, like, say for instance in a restaurant or wherever, where you actually complain about the quality of the service or the quality of food or whatever, you might find that people become they take it as an offense, become very offensive or very defensive with regards to that specific issue. And I think that is also one of the issues that need to be at a level where there is a kind of coordination and control to make sure that it is not only the responsibility of, say, the municipality, but it is the responsibility of all departments that is within that environment to make sure that there is more and more awareness within our society, because the consumers are the society. So within the society, how do we make sure that we coordinate the whole issue of making sure that people understand better that you also have, each one of us have a responsibility to ensure that there is safe consumption of food, and particularly on the, also Professor mentioned the issue of fruits in the place of this snacks that we now find that the ladies are standing outside the school gate and they are selling this snacks, this colored snacks and so on, that you don't know where the coloring is coming from, what chemicals is being used for that coloring and so on. Whereas if you have fresh fruit or fresh vegetables, because remember we used to eat carrots and things like that because we didn't have money for luxury, but it has changed totally. Society has become so artificial, and how are we going to make sure that we educate our people to bring them back to the basics that we used to grow up with? Thank you very much, Chairperson.
Thank you. Thank you, Honorable Lucas, and all the other members that have raised issues. Professor, before you respond to some of these issues that were raised, I just want to deal with one that Honorable Mkutama raised regarding the comments and the article of Dr. Van Vuren. I think we explained in the beginning the interaction that we've had with Dr. Van Vuren, and I think that you don't have to go into that, Prof. And Honorable Mkutama, I think what Dr. Van Vuren was saying in the response that we've heard from him when we interacted with him was that all he was saying was that there should be an investigation into the source of these pesticides and how it got into spaza shops, and in such quantities that it will even kill people and young children. So without the investigation, and we referred to it earlier when we started, that the minister has actually promised that he was going to come back and give us a view of, or a report on what the department investigation has found out, or the relevant institutions that have been investigating as to what was happening. So you may just leave that, Prof. And especially because this situation, as Honorable Mkutama was saying, happened and continue probably to happen in spaza shops, And because spaza shops are in villages and townships, and they are not regulated or inspected, or often inspected, if not inspected at all. And I think that you spoke about it, Professor, the food safety, when you went on to talk about one food system and the like, and the informal food system that happens in the country. So please don't go into that, because as Honorable Kotama has said, he's talking about an article that is not related to yourself, but related to Dr. Van Vuuren, and we did speak to Dr. Van Vuuren. Professor, please do respond to those issues that you would like to do so, issues that have been raised by the honorable members. Thank you, Prof.
Thank you very much, and thank you very much for all the questions. It's really great. I really enjoy it, and I want to respond. I'm going to start with Honorable Matusi. I was just noting the names on my participants list here. I want to talk to you about the irrigation water and just explain a little bit more around fit for purpose. So the Water Research Commission has funded our research group for the last 10 years. We have been doing extensive research in terms of the water quality. We've looked at roof harvested rainwater, and we actually, at the end of this report, advised that all roof harvested rainwater should follow a certain best practice routine. For instance, if you have overhanging branches over your roof, you will have birds sitting there and they will be droppings. We could show that E. coli levels directly linked with bird droppings was present in roof harvested rainwater. So you then have to put filters in or remove the branches. The second thing is, if you have seasonal rain, for instance, your rain at the beginning of the rain season, you must use flash diverters. That water should not be harvested because it will be full of dust and particles that accumulated during the dry season. So we provided we did a risk assessment for them, and we surveyed almost the whole country. So we've done extensive work on roof harvested rainwater. That report, in fact, there's electronic copies and hard copies, and I'm very willing to go and take these hard copies to Department of Agriculture and Health. But you are right, we did not share it further with Department of Agriculture or Water and Sanitation. And I think that's a really significant pity. I think we should actually hold a water indaba, and I will talk to Water Research Commission. You also asked a question about the river water that's been used in irrigation, and whether we've looked at just certain areas or how extensive. We, for instance, did one study with that whole river water from the Crocodile River down. We've done the whole Apis River. We've taken several rivers, and some of the other scientists focus on some of the ones in the Cape, for instance. We all work together. When we had the cholera outbreak, the Water Research Commission came to us and said, can you immediately look at the cholera and identify if it's present, where it came from, is it present on the crops, using source tracking technology, which we have in our lab. So we could, within a few months, give Department of Water Research Commission a report. Purely because I had capacity, I had people, we were trained, and we had expertise in it. With other words, if you have a fire, you need a fire brigade, you need a fire station, you need trained firemen. You can't, once the fire starts, go and look for a water tank and a fire brigade to come and help you. When you have the big fires in some of the game lodges, they need to have a system ready that can immediately go and address the crisis. That's what we need. We need a system that's immediately ready, where we communicate with everyone. If I start picking up something, I must be able to put that information into the system so that it can filter through and we can immediately have a response. So we currently have a project where we're going to start surveillance in several rivers in the country. We are mainly looking, in this case, for waterborne and foodborne pathogens, and we will look at antimicrobial resistance. But I do know some of my colleagues are working on chemicals. Now, we have previously done a study on endocrine disruptors. These are the byproducts of a lot of the pesticides that's sprayed and then the runoff into the rivers. And that ends up on the food products. And in fact, in Thomas's study, he could show that the EDCs ended up in the food products. So it's not only the microbial, but also the chemical, to have a good understanding what's happening in our water, the quality of our water, the chemical and microbial quality, and if it's fit for purpose. I think it's in national interest to address it. And I think we should have a indaba around this. And it's something that I believe all the different relevant departments and stakeholders need to get together. And then handling and dealing with chemicals from a point of taking it into the curriculum. I cannot see why a chemistry teacher in grade 5, for instance, can't make part of his curriculum that he talks about. They teach children about chemicals. Why can't they add to it chemical safety? Just a maybe small introduction, and then build it up into high school where you have more awareness and information that you share with young scholars about chemicals, because chemicals come in many forms. Chemicals to for our swimming pools, or chemicals to clean, or chemicals to kill rats or insects. We must all know how to use it and store it. It's and house cleaning chemicals, particularly. Every human being should know how to use it. Children's deaths are often associated with chemicals that's been poured or recanted into another bottle without a label, and it's just put at the bottom between the food, and then a child comes and they drink it. There's so many reported cases of this. It is incredible. So whose responsibility is it? It is the parents. It starts with us as an individual to start taking responsibility. And I think we need to use the tools, such as the schools, that we can push it, the importance of it in the school curriculum. Health and safety on the farms, and with the farm workers, their living facilities. I know a lot of there's a lot of farmers that, and not only fresh produce. I mainly work with fresh produce, and these farmers export. And the minute people export, they get inspected. They will come and look at the farmers' dwellings where the workers stay. They will look at everything, their pesticide records. I find those farms really compliant. The problem is not all farms export. So it's the second group of medium-sized farms that I find often is a non-compliant factor. And maybe we should focus more on that middle and smaller scale farms, because your mega farms, your big farms, and the export farms, I can assure you they are so regularly inspected. They are over-inspected. They get inspected at least 4 or 5 times, inspected, audited. They it's really, they're often certified for 3 or 4 standards. So, and it is costly. It's a very true reflection of the reality of ensuring safe food. So how do we take that and we scale it down to a level where from the smallest to the biggest? And that's why we think best practices, fit for purpose, lead to eventually good agricultural practices, good hygiene, good manufacturing practices, etc., etc. So I believe we need to start building, and that can go into the curriculum as well. Every child. I really like the proposal of an agriculture and food as a subject for all kids at school. Every human being should be able to grow their own food. What if we have more floods and we don't have food, or we have more droughts? Everyone should be able, even in your windowsill, even if it's just a little bit of lettuce, but everyone should take responsibility to grow some food, to produce some food. And I also want to add to it, and this to me was also addressing the question later on about the consumer. We must bring back the appreciation of good food. I often look at people, the way they eat. People grab food, they put it in their mouth, and they run off. That is not the way it was intended. It's a minute that you stop, you sit together, like in the old days, traditionally, with that indigenous knowledge, how we prepared our food, how we stored our food, how we consumed it, how we preserved it. We've lost that knowledge. We've lost the knowledge around our own indigenous food, the ability to appreciate it. So it's easy for us to just buy a packet of those horrible curly whirly things. No, people should eat it. I'm at my children, I make sure they don't. I'm outspoken about it. We should cultivate people to appreciate good food, to enjoy food, to bring back their joy. I was recently in China, and I spoke to their consumer science department. And what they were doing in China, they had a national program to go and harvest that indigenous knowledge of how did they make and prepare the food. They have a kitchen, a chef kitchen, where they invite these people from the small areas, rural areas, to come and show and demonstrate how they make their specific food, so they can capture and get the appreciation back for own food, local food, good food. And then what the university did in that case, they used it for training material, and from there they developed new recipes. And they actually give credit to that person who then came and demonstrated. They had video recordings. And I thought that's what we should be doing in South Africa. I know at Pretoria University, we have a consumer science department that looks like Master Chef. They have a chef, a PhD chef. We have the people to do it. We must just do it. We must enforce it. So I believe we must work at school curriculum. We must bring back the appreciation for good food, nutritious food. There's studies that now show that the gut microbiome is directly linked with dementia and Alzheimer's. The increase in dementia and Alzheimer's is directly linked with that. And non-communicable diseases, obesity, diabetes. We must change the way we look at food. It must become a priority for us in this country. And from a lawmaker's point of view, you can't by law do it, but you can create this new cult of good food. And we have lovely African food. We need to appreciate it. And everyone can afford it and must be available to all. The issue around government and the alcohol, we're going to hear more and more deaths associated with alcohol and counterfeit products and recantering of food with no label on. It's happening as we speak. How are we going to stop it? We must stop it. If you recant or you take, the case we specifically followed was Nestle baby formula milk. They would pour it into little small bags. You can pay 2 rand for a little bag, 1 rand. Then you just mix it with water and you feed the baby. It's the worst thing. We actually found you can find things like soap powder in it or mix stuff into it to get volume. That is currently happening. We should do a proper survey throughout this country that we know exactly what is the status of our food everywhere. And we have to get it regulated. And people must take responsibility and help us. We can create an app, the Bad Food app. If you come across, you buy somewhere for 1 rand a bag of baby powder, or counterfeit products. It's not even say a milk, a Nestle product. It's another product, but they say it's a Nestle product. We need to report it. We need to use that app, and it must be available to all. So I believe these to me are really very important to change this mindset, because we have to fight it from all sides. And then Honorable Trollip also spoke about the national crisis. It is indeed. We need to address the water treatment plants. That's the problem. It's that sewage going into our river water. It's not acceptable. We must change it. But also the industrial development areas, the mining sector, the pollution of our water is continuing. We must talk to our Minister of Environment and Water and Sanitation and bring all of them together with agriculture and have a better strategy to protect our water. And we have to do it. Time is running out. We're going into a water scarcity, and it's going to increase the risk of this. And we do need water for healthy minds and well-being, and to grow good crops, and to ensure we stay on the export market. They will indeed start testing our products more. They are aware our water is highly contaminated. We already have problems from the European Union. We are shifting our products to other markets, but they're also going to test our products. Nobody wants to bring someone else's problem into your country. And that takes me to, how does these chemicals come into our country? We have to secure our borders. We have to make sure this stuff is not illegally moving into our country. We have a right to demand that. We have a right to say, are you a legal shop owner? I know it's a sensitive topic to talk about the spaza shops, but they have to be regulated. You cannot come into a country and put up a shop and sell stuff that's not pure or hygienic, or that's contaminated. We have to stop it. I call it the food zamas, because we can't allow this. We have to give safe, nutritious food to all our people. And that to me is extremely important. The other point that Honorable Trollip mentioned was the AI support in training. I believe we've got access to platforms. We need to create a South African platform for us, and that's why I want funding for a food safety knowledge hub. Or I have already spoken to DSI and NRA if they can't come on board, and maybe if all the other government departments, and maybe if it can be a suggestion from this specific meeting and parliamentary investigation, that we come up with a proposal that South Africa need a strong food safety research and develop a knowledge hub. I think that will be extremely important. And then I agree with training, and particularly our extension officers, and increasing general awareness and support. And then Honorable Adelaide, how did chemicals get into spaza shops? And it's not in retail. And that is a reflection of the illegal movement of the stuff. It comes in illegally, it gets repacked into small bags, it's handled, it gets shifted into that illegal framework. And that's why your retailers will not touch a product that doesn't have a label, a sell-by date, because they can be held legally accountable. All we have to do is look at Tiger Brands, the so-called court case around the listeria that's still hovering above Tiger Brands, which can potentially destroy the whole company. So why can't we have the same kind of enforcement, or ensure that there's a regulatory framework to make sure that everyone at least comply? I agree. The issue is people don't want to buy a whole bag of rice. You want a smaller packet because you can't afford a bag. So why don't we push that back to industry and say you need to give different sizes? The chemical industry is a good example. Pesticides, you can only buy big volumes of pesticides. And 20 years ago, I did a study for USDA in SADC to look at pesticides, distribution, sales, illegal pesticides, dumping of pesticides, etc., etc. And one of the statements I made and my proposals was that chemical companies should take responsibility to have smaller volumes for small-scale farmers, because that a farmer can buy a little packet for a once-off spray. So I think this is why I say everyone must be on board to find a solution. And then the comment around the Independent Food Safety Authority, yes, I agree. I think we must revisit this Food Safety Authority for South Africa. I think that's a very important conversation, and we should push it back to presidential level, that it gets pushed from that level, that we must put a proposal on the table from government. How are we going to address food safety on a long-term strategy so that we do not have these reoccurring events? And then Honorable Lucas referred to the regulatory framework, the inspectors. And yes, I think it's extremely important that we must increase their capacity. But there's also an element of honesty, integrity. You know, currently I'm thinking they're doing an excellent job, and they're really picking up a lot of unregular or unregistered spaza shops. But we need to do more, and we need to make sure there's no corruption coming into this. So we need a good system, and we need really committed people, and maybe bring in more of the community to become a community regulatory framework where your community start regulating those spaza shops. And then I think a very important thing is distribution is really weak, particularly in the informal sector. It's not only the vehicles that you transport in, but it's the storage facilities where you store. And we often see that with groundnuts and mycotoxins. They store it under unhygienic conditions with high temperatures, humidity, and then the fungi will grow. So you have to have proper storage facilities. And then how do we create an conducive environment? It's our responsibility. The air quality must be safe, and it must create a safe environment for all children and adults, and the elderly. Your environment where you live must be clean. I want to use Rwanda as an example, in China. I visited both of them recently. It is so clean and hygienic. And I asked the people in China, so how did you do it? Because 10, 15 years ago when I was there, it wasn't like this. And they totally turned it around. Now people don't spit, they don't throw things in the street, they put it in. People has taken responsibility. There was a mind shift in the country. And I've seen the same in Rwanda. And I was just thinking, it becomes everyone's responsibility to create and help support a clean environment. We must not litter. We must clean after ourselves. We must make everyone responsible to clean and help create a clean environment. And then the last questions, how far have we progressed? Do we have an effective food safety environment? We have not progressed. We should have a model system for Africa by now. We should have a very strong food safety authority in Africa, and South Africa should take the lead in this. So I think we have a long way to go, and we must make that a priority. Consumer awareness, people must take responsibility. I think it's not fair to say it's just government's responsibility. It's everyone's responsibility, and people really need to become part of this journey. And I think the society needs to change the mindset and participation. And people must appreciate good food. And really, I think it's so important to look at this holistically. And that's my comments. Thank you.
Thank you very much, Prof. People must enjoy good food. Yeah. I'm taking that home. And I think that's very important. We have a problem in that today we don't have more schools that have gardening, where there's food that comes fresh from the garden. And indeed, people, they seem to be busy and running every day. Nobody wants to sit down and enjoy food. We truly appreciate your time, Professor, and having taken time to come, but also to respond to the issues that are raised by honorable members here. You have clarified and assisted. We have gained more information as a committee that is responsible for making sure that we monitor what the department and the ministry is doing. So we really appreciate it. DG, compliment of the new year. We have not spoken to you this year. If you are here, would you like to greet the honorable members and the professor before we could go into closing the meeting?
No, thank you very much, Honorable Chair, and my apologies for the late joining. We had challenges in terms of accessing the meeting per se, Greetings to the honorable members of the Portfolio Committee on Agriculture. Looking forward to big engagements for 2025. Let me also greet Professor Liz Kosten, who has been with us in terms of the department and who the department in many ways, shapes and forms, has been sending students just to be schooled around food safety in that area. I would not declare more than that and would await for next week so that we can be able to respond to the issues that have been raised. Quite a few issues that are very important, I think, that will capture in terms of the department's response next week. Thank you very much, Honorable Chair, Honorable Members, Prof. Kosten, and the colleagues who are on the platform.
Thank you very much, DG. We're looking forward to seeing you and meeting you as a department and the Minister and Deputy Minister next week, so that we get the report from your part. I'm glad that you did attend today. In future, we will sort it out, the accessing of our meetings, where you are supposed to be also coming in, even if it has to be you sitting with us listening to the invitees of the Portfolio Committee, because it's important that you get information that would also assist the department to be able to assist this committee as we do oversight. Professor Kosten, I can't express more our appreciation for coming to attend the Portfolio Committee this morning. On behalf of the honorable members of the Portfolio Committee on Agriculture, I would like to say thank you very much, and hopefully you will avail yourself in the future when the Portfolio Committee requests your presence in the committee for more information. But for today, thank you very much. Honorable members, thank you very much for your time. For today, we will then meet next week on the 4th. That will be physical in Parliament. The meeting is officially adjourned. Thank you very much.
Thank you very much.
Recording stopped.